Viral infections can be really dangerous, and when they happen to kids, they can be catastrophic. Do not wait for your kid to get infected by a viral disease before you seek medical help. Most of the times when we have these babies, we are advised to get them vaccinated right there and then at the hospital. Please do not be reluctant to get your kids vaccinated. Welcome to another segment of Obatania here at City Star TV. If you haven't subscribed, I always keep reminding you to subscribe and then hit the notification bell. Don't miss out on any other exciting episodes. Follow us on all our social media handles on Facebook, on TikTok, on Instagram, and Twitter. The name is City Star TV. I'm your host, Nanaya. Kindly do so, and I'll be right back. Welcome back, lovely viewers. As I was telling you earlier, some of these viral diseases can be very catastrophic for our kids. We've been discussing the 6 killer diseases in Africa, in the world, the 6 killer diseases known to really affect children when they are really young. And one of these diseases is measles. Today, here at Abatanya, we're going to discuss what measles is, what it means when your child gets it, how to treat it, how to prevent it, if there is a cure for measles. And with me here is our lovely midwife, Benedicta Asari, all the way from New Tafel Government Hospital, here to once again educate us on this very particular disease. Welcome, Benedicta. Looking beautiful as always. You're always glowing. I'm so jealous. No. Okay, so not to waste a lot of time, let's go to today's main topic, measles. And as we all know, it's a very sensitive topic because this is a disease that affects a lot of our kids, especially when they are growing up. And sometimes even adults also get measles. So I'm going to ask you to just kindly tell us a little bit about when we say measles, what exactly is that what disease is that?
Measles is also a viral infection. It's a viral disease, sorry. So it also affects children and even some adults. Measles is a style. I say, when it starts, if you don't take care, you would think it's a normal rash. And before a baby say measles, no. Na edikan astati ye juma dada, so that is how measles works.
Okay.
Yeah. And it's viral. It's also viral, just like the one
the other time.
Yeah.
So some of us say measles. How will I know that my child has measles? What are some of the signs and symptoms that precedes this disease?
So most of the viral infections they have similar signs. So measles, and also as usual, running fever, then cough.
Okay.
Yes, see coughs. Then before the rash will appear on the skin, it starts inside the body.
Okay.
So it will take time. Then it will appear on the skin. Yes. So measles, when it starts with this normal, mild to severe fever. Then a cough, so the child will be coughing.
And sometimes when they cough, they also get runny nose and all these things.
And that is what makes it scary, because since it's a viral infection, if I have it and I cough, the droplets you can also pick it.
Okay.
Yeah.
Okay, so some of these may include, and I've seen there was I think a situation I came up upon by chance. A kid, she had what do we call it? Measles and her eyes.
Yes, so there's another one called conjunctivitis.
Okay.
So that one, reddening of the eyes.
Okay.
Then watery eyes. They have that too. Then they have runny nose. It comes along with the runny nose.
Oh, okay. So these are all symptoms. So if you have a kid and you are seeing all this redness of the eye, because I cannot say that other word, and then your kid's nose is running and then your kid is coughing, before even the rash appears.
The rash appears
at the latter stage. Yeah. So when the rash appears, then you know that it's already there.
Sure.
It's getting to the end stage of it. So at the beginning, you see all these things. That should tell you that your kid has measles. Your kid has measles. So when this happens, is there some, what kind of treatment plan do you go on for?
Okay, so it starts from the time, so it starts from when the time the child gets the disease till it appears. So the incubation period is between 10 to 14, 10 to 12 and 14 days.
Oh,
That's when
okay.
you get to really know that
No, your
your
child
child has
has
it.
measles.
Yes. So that's one too. When you take the child to the hospital, the doctor will ask you, what is wrong with your child? So you will have to give the doctor a detailed explanations of
Description.
what
What
you are
I've seen.
seeing, what
Okay.
the child is presenting. Now, we said earlier that the child is going to get a high temperature, that is the fever. The child is going to get runny nose. The child is going to get conjunctivitis, that is the redness and the watery eyes. Yes, the child is going to cough and stuff. So, with all of that, then the doctor will tell you that, okay, let's take the child to the lab. So they will run tests,
On
and
the
then
child.
yes, and then they will isolate the virus.
And then
And to
that's how they will be able to
yeah,
diagnose. Okay, so once the diagnosis goes through and it comes out that yes, indeed, based on the symptoms of the child and all the tests that they've run, the child indeed has the measles virus. What's the next step?
so he will treat it for you.
Okay,
Yes, and measles comes with something we call the complex spots.
okay.
Some redness. The rashes are reddened, and it's really
Is
itchy.
she?
So it will appear on the skin. So they can't just treat the ones on the skin because it is already working inside of the
Before
child
it even
before
came
it
out.
even comes out. So then the doctor will give antibiotics and drugs for it to kill
What
it
is
outside.
within?
And then, the rash, it doesn't just come on the skin, it appears on the face. So when it starts going off, when it's treated inside and it starts healing, you see that the rash starts disappearing from the face to the skin and the hands.
Oh, okay. So okay, so the treatment, is it medication?
Yes,
Is
it
it
is medication and then topical creams, so that as ochiti akwala na de akwa aircom no any scars.
one
I want
home?
to. So we give medications, then we give topical things. And then one of the things that cause measles, when a child is lacks vitamin C, vitamin A, sorry. And vitamin A, the child needs green leafy vegetables.
Okay.
So yeah, fruits. Some children do not like fruits when they are
Yes.
children.
Okay.
Some do not like fruits, but you have to find a way of adding it to their diet. And the green leaves, they are very good. In fact, and everybody should add green leaves to their diet.
Okay, so like she said, some children do not like fruits and you have to find a way to add it to a diet. So let me use this opportunity to remind you that we have an exclusive episode on quick ways to make baby food, baby recipes that you can actually do and add it to your baby's diet. So if you haven't seen that episode, look out for it on our channel. It's quick baby food recipes that are out there that you can actually do. Just your fruits and your baby formula and water. We've taught you how to do it. Go watch that episode, learn how to use that, and then you can really add the fruits to your baby's diet to make sure that your baby get the vitamin A that they need. So these are how you're treating it. Now your baby has measles and all the rashes. Is it advisable to scratch? Because like you said, it really itches.
Yeah.
Is it advisable to scratch?
When something is itchy, it is itchy. You understand? While you penny cry, you would scratch at a point. So that is when you have to. Definitely, the child will scratch. Mommy, by the time you realize, no scratching. But it is not advisable because the more
Okay.
you understand?
Yes.
So as this place is itchy, I'm just scratching, and by the time you realize, you'll be introducing the virus to other parts of the body because it's already spreading. So you're just giving the virus a higher platform, a bigger platform to spread well. Yes, so it's not. That is why we give the topical creams so that it will lessen
The itchiness,
Yeah.
so you don't have to scratch too much. So we are learning a lot. She told us how these diseases comes to be. She told us the signs and symptoms, and we are also talking about the treatment. We are talking about a lot. We have a lot more to discuss, so do not go anywhere. We will be right back. Welcome back, lovely viewers. We are still here at Obatanye and we are discussing measles. Measles is a viral disease that affects our children a lot and it can be really dangerous to your child's health. So We are talking about how to prevent it. We are talking about how to treat it. We are talking about what causes it and what to look out for to know if your child has measles or not. So before we left, our beautiful midwife here had told us a lot, and she's still going to continue to educate us on what measles is and how to stop it. So let me ask you this then. I know we've talked about what causes it, but with the causal agent, is there any way to prevent it from happening to your child?
Yes. So you will have to, the first step, you will have to vaccinate your child against the measles.
So she's telling you there's a vaccination available for me. There's a measles vaccine out there.
Yes. And then for the measles vaccines, we give it twice. So when a child is 9 months, we give the first vaccine. When a child is 18 months, we give the second vaccine. Now, somebody will ask me, so 9 months, so what happens if the child gets it before the 9 months? When the child gets it before the 9 months, we treat it. And for measles, whatever the child presents, they will just treat. So when you come and you see your child is having a persistent cough, your child is not feeling well, your child, they will just treat it according to whatever the child presents.
So the symptoms.
So yes, and then they would also know that oh, this thing may be measles, because for measles presentation, it's always like that. So they will treat it for you. So, and then when your child gets it, it means that your child will not be given the vaccine
again.
Well, your child will not be given the vaccine at the 9 months, because we've already started treating it for the child. So when a child gets to 1 year, then we give a booster.
Oh, okay. Okay, this is new information for me. So, yeah. Okay. I guess it's also new information for some of you. Yes. So if your child, you are supposed to get the vaccine for your child at 9 months, if I'm getting it right. Yes. But if your child should contract the measles, the first vaccine is given at 9 months and then 18 months for the second one. But if your child should get the measles before the 9th month, when you're supposed to go in for the first shot, you treat it. And because the child has already been infected, they don't get the vaccine anymore. When they are 1 year, they get a booster. Okay. All right. So that's how it works. Yeah. Okay. So the preventive method is the vaccine. And aside the vaccine, is there any other thing?
So when sometimes adults also get. So definitely when you get it, you go to the hospital, you go to the lab, they will take samples and then they will treat it.
But why do adults get? Because sometimes too, it also happens that you vaccinated your child, and then later in the years, they get the measles anyway.
So it's and the vaccine protects you for a period. Now, when you get to areas where you there are cases of measles, there means that the virus is there. If you don't take care of yourself, you can contract
it. Okay. So it means even though you are vaccinated, the vaccine is temporary.
Yes, it is. So when you give it to a child, it protects a child for a period. Now, this is it. Most children would not even get it before the 9 months, because the mother's immunity covers the child. You understand?
Yeah.
Yes. So when they are pregnant and they go to the hospital, at a point they give them vitamin A supplements. It also helps. It helps. Now, if the mother's immunity is that good and that strong, it means that it's going to protect the child. So when you boost your immunity, there's not a chance you are going to get it. You understand? Okay. So this is the case. You are now grown, like let's say 30 years, and then you don't take care of yourself. You eat anyhow. Your immunity has gone that low and everything. Now you are in an area where
there's an outbreak of measles.
There's an outbreak, or there's somebody there who has the measles. You are very close to the person, you touch the person. Your personal hygiene in this case is very much important. Now, most of the viral infections, almost all of the viral infections, if you don't take care of yourself, you will get it. We just have just a few of them that you have to go an extra mile before you get it. But most of them, if your personal hygiene is very poor, you get it. That is why even sometimes when you go outside and you buy food from an unhealthy place, you go and eat it and then you get sick. It is easy for you to pick viral infections. So you think, oh, when I was a kid, they gave me a vaccine. So no, you by the time you realize you are getting it.
So that means personal hygiene, being very cautious of our environments, making sure we stay clean. Personal hygiene is very important. I cannot stress on this enough. If you know you're not taking good care of yourself and your environment, please start doing so right now. Do not be cocky that you have the vaccine. Apparently, if you do, it's only for a certain period of time. After a while, you are still prone to get the disease. And unfortunately, measles hasn't been eradicated from Africa or from our country like polio has. It's still happening. A lot of children are getting measles. A lot of adults out there are getting measles. So you need to be very cautious. Take care of yourself. Take care of your child. Kindly keep on watching and we'll be right back. Welcome back. So we are still talking about measles here with our beautiful midwife Benedicta Sari, all the way from New Tafel Government Hospital, and we discussed a lot. And most of the times here in Africa, here in Ghana, we like to associate some of these diseases with spirituality. That it's the gods and all that. Mothers, please, you have to just go to the hospital, follow the procedure. Church might not help, prayers might not help. Sometimes you just need to go in for the vaccine because these things can be very dangerous to your child. And I need you to know how dangerous we are talking about, because now I'm about to ask our midwife here to tell you about some of the complications that can arise if you do not treat the measles that your child gets. So can you tell them how some of these complications
measles
go?
has its own complications. Now, one of the dangerous ones you can see is that because it affects your immunity is impaired, it can give you, one of the things is pneumonia, because it attacks your lungs. Your immunity is already impaired, and there's a viral infection introduced to your body. One of the easiest parts it can just attack is your lungs, so you can get pneumonia. And then your ear. When the virus enters your body, it just gets
Attacks
to
it.
all the places that are easily to just destroy. So you can also get ear infections from them. Then we are talking of diarrhea and a lot of vomiting. That one, for diarrhea, you will get it.
So that means dehydration also sets
Of course, the moment you start having diarrhea, you are dehydrated. So it means that you have to take in lots of water. But you see, when you get sick, it is even difficult for you
need to drink water.
So you will just be bedridden. That's how bad
measles can get. So do not take that risk of saying.
It's not good for pregnant women as well. When you are pregnant and you get measles, it means that it's going to. Now, every pregnant woman, when you get an infection, it means that your child is also at risk here. So whatever thing you see when you are pregnant and it's not normal, just report it. Okay, so when you report it, then your midwives and your doctors will treat it for you before it gets out of hand.
So please, like she's saying, report it. Whatever it is, don't take any chance. Don't take any chances. This is your life and the life of your kid here that you're playing with. Do not take chances with your life or your kid's life. Please, please, and please again. And as I'm telling you, I'm going to, let's say, advise you about this, because this disease is very dangerous. It might look like a rash, but it's not. It comes with its own complications. It can get so severe you'll be bedridden. So please listen to what our midwife has to say. Any advice for the public?
All right. So measles can easily spread. Measles can just, and it is so sad that it is so in a continent.
Yes.
And when somebody gets it, it is easy. Even when you exchange things, personal stuff with the person, and the person has the virus, it is easy for the person to give it to you. So the one thing I always tell my people, before you attribute your condition to a spirituality, please go to the hospital and let the doctor tell you that we don't have a cure. Then you can contact your spiritual gurus. But until then, go to the hospital. Take care of yourself. Viral infections are very difficult to treat. So the best thing you can do for yourself is to maintain or upgrade your personal hygiene. Do not be touching anything. If you have any sickness, if you are going through something that is new to you, please report it to the hospital. Let us take good care of you. Wash your hands very well with soap, and I insist with soap and under running water, not with a water in a basin, under running water. You clean your hands well after washing, and then don't be touching surfaces and then putting your hands. You see, it's easy for you. Maybe that on this table you have a pen, you take it, and as we are conversing, consciously or unconsciously, you put the pen in your mouth. Meanwhile, maybe somebody coughed, somebody sneezed, and then the person has a virus you don't know. The person has already introduced it. The moment you put that thing in your mouth,
I've
you have
also
you have
introduced it to
given
my
the
system.
virus a chance to spread, so it will just enter. So we have to just be conscious of ourselves, taking care of ourselves. Whatever we touch, whatever we handle, make sure that it is clean, and don't be putting your hands in your nose and your mouth. You introduce virus.
Thank you, Madam Benedicta Asari, who is a midwife from New Tafel Government Hospital, for making the time to come and educate us on what measles is, the dangers that it poses to ourselves and our children. We really appreciate your time. To our lovely viewers, I hope you learned a lot, because I know I did. I got some new information I had no idea that even existed. So I hope you learned a lot. So this is why I keep reminding you, if you haven't subscribed, you are missing out. Please subscribe to our YouTube channel and then hit the notification bell so you don't miss any of our other exciting episodes. Follow us on all our social media handles on Facebook, on TikTok, on Instagram, and Twitter. The name is City Star TV. I'm your host as always, Nonaya. Catch you same time next week.